Hey everyone, and welcome. If you're a medical coding student, you already know that the CPT manual is basically your new best friend. So today, we're going to build out your essential coders toolkit by diving into the guidelines for one of the biggest, most diverse sections in the entire manual, medicine.
And I get it. When you first crack open the medicine section, it can feel, well, a little overwhelming. It's got everything from vaccines to psychiatry to physical therapy. But here's the secret. Once you get a handle on its core rules, you'll have the foundation you need to code with real confidence. So that's what we're going to do. Build that foundation, tool by tool.
Okay, so first things first. Before we start grabbing our tools, we need to understand the blueprint. What even is the medicine section all about? Well, the medicine section is just incredibly diverse. It covers services that are diagnostic, like a cardiac stress test, therapeutic, like psychotherapy, preventive, like getting an immunization, or even rehabilitative, like physical therapy. Now, the most important thing to get right now is that this section has its own unique set of rules on top of the general CPT guidelines you're already learning. It's like they're the specific bylaws for this one big neighborhood in the CPT city.
All right, let's grab our first tool from the toolkit. This one is all about how we handle procedures that aren't exactly by the book. What happens when a provider does a little something extra, or when they perform a service that's usually just one small part of a much bigger procedure?
This brings us to two concepts you absolutely have to get down: add-on codes and separate procedures. Now, they might sound kind of similar, but they are totally different. An add-on code is for something extra that's done with a main service. A separate procedure, on the other hand, is for something that's normally part of a bigger service, but this time it was done all on its own. Let's break that down a bit more. Okay, so add-on codes. The single most important rule here, the one you can't forget, is that they are never reported alone. Ever. Think of them as the sidekick. They always need a primary procedure, a hero code to go with them. You'll spot them in your CPT book because they have that little plus symbol right next to them. And since they're supplemental, they're exempt from those multiple procedure payment reductions, which means you never, ever stick a modifier 51 on them. Now for separate procedures. Okay, this is where it gets really interesting. These are services that most of the time are just bundled into a bigger procedure. So the big question is, when can you actually report them separately? Only when that service stands completely on its own 2 feet. Maybe it was done in a different session or on a completely different organ system or for a different injury altogether. And when you do report it separately, you have to append modifier 59. That's your signal to the payer that says, hey, I know this usually looks bundled, but trust me, this was a totally distinct and separate service. Awesome. Now let's grab tool number 2, coding the unlisted. This is your game plan for when you come across a service that's so new or so rare, it doesn't even have its own code yet. So what do? You've searched the index, you've flipped through the whole section, and nothing. There is no code that actually describes what the physician did. Now, you can't just pick the closest code. That is a huge compliance no-no. So, what's the right move? The answer is a really clear 2-step protocol. First, you find the right unlisted procedure code for that section, which usually ends in 99. Then, and this part is absolutely critical, you have to write up and submit a detailed special report with the claim. You can't just send in the unlisted code all by itself and hope for the best. You should think of the special report as your chance to talk directly to the insurance payer. The unlisted code just tells them, hey, I did something that's not in the book. The special report is where you get to explain exactly what that something was and, just as important, why it was medically necessary to do it. So what do you put in this report? Just think of it like a checklist. You need a really clear description of the service, the nature and the extent of it, and of course, proof of medical necessity. You also want to detail the resources involved, the doctor's time and effort and any special equipment that was used. This gives the payer the complete picture. Okay, moving on to our third tool. This one is all about accounting for the details. Those little things that can make or break the accuracy of your coding. First up, imaging guidance. Sometimes a provider uses imaging, like an ultrasound, to help guide a needle during a procedure. If they do, you can option report that guidance as a separate service. But there are a few conditions. It has to be medically necessary, it has to be documented properly in the report, and you need to follow the rules that are laid out in the radiology section guideline. But here's a really common trap you need to avoid.
The term imaging guidance in CPT land refers to very specific things like fluoroscopy, ultrasound, or CT scans. It does not apply to other kinds of tracking systems like electromagnetic or radar localization. That's a super important distinction to remember. Next up, what about supplies? If a provider uses materials that are above and beyond what's normally included for a service, like, say, a special kind of casting material or a whole surgical tray, you might be able to report it separately. You'd usually use code 99070, or more likely, a specific HCPCS code that really nails down what the supply was.
And that brings us to our final and maybe the most powerful tool in the whole toolkit, defining terms. In the world of coding, definitions are everything. How the CPT manual defines a single word can completely change how you report an entire service. Let's look at a perfect example. Implant versus foreign body. This seems pretty simple, right? An implant is something a doctor puts in on purpose. A pacemaker, a surgical screw, you get it. A foreign body is something that gets in there by accident, like a splinter or maybe a coin that was swallowed. The key difference here is all about intent. But here's the twist. According to the CPT guidelines, if an implant, that thing that was put in on purpose, migrates from where it should be, or it breaks, or it just becomes a hazard, its removal can actually be coded as a foreign body removal. I know, right? This is the perfect example of why you have to always code from the guidelines and not from your own assumptions.
And there you have it. Your foundational medicine section toolkit is officially assembled. We've got add-on codes, separate procedures, unlisted services, and critical definitions. It is so important to see these rules not as a bunch of obstacles, but as the actual language that we use to communicate medical services with precision and with clarity. So, as you keep going in your studies, I'll leave you with this question. Now that you have these tools in your belt, which one are you going to focus on mastering first? Are you going to nail down the difference with separate procedures, or are you going to perfect the art of writing a killer special report? Your journey to becoming a great coder starts with mastering one tool at a time. Keep up the great work.